Hello, everyone. Welcome. My name is Dr. George Papakostas, and I'm professor of psychiatry at Harvard Medical School. And this today is 5-minute pearls for the Journal of Clinical Psychiatry. There's 4 things that I wanted to share that I think are key ingredients to a successful engagement when diagnosing and treating a patient with major depressive disorder. So the first, I think, is critically important, and it has to do with your reaction when eliciting symptoms. I think that the most appropriate reaction is to kind of share with the patient that their symptoms are common, that they're treatable, and that you totally have a handle and an understanding on the situation, because that will reassure the patient that they're in good hands, that what they're experiencing is something that's very common and treatable, and will inflate the placebo response and help with the doctor-patient rapport. The second critical thing to do is to find a way to measure symptoms of depression. Personally, I use a clinician-rated scale. I use the Hamilton scale, but most people use a patient-rated scale. And there's 2 reasons why that's important. The first reason, you'll have an understanding of how symptoms fluctuate over time. The second reason why that's important, and it's not less important than the first, is because it educates the patient around what the goal of treatment is. You know, many times, almost always, if you let patients share their experience with depression, they're going to focus on psychosocial issues, like how depression is making their life difficult, how depression is making their work difficult. It's critically important to shift that discussion from the external realm to the internal realm. So from psychosocial to symptom-based. And that is a very important thing to be able to do during the course of treatment. The third important thing to remember is to not linger on a specific dose, on a low dose, but to always try to optimize the dose. So for the average patient, I optimize the dose every 2 weeks. If someone is very ill, very symptomatic, I even optimize the dose every week in the beginning. And that, of course, takes into consideration tolerability. But tolerability aside, you really want to be doing something every 1 to 2 weeks. And that's in the benefit of the patient so that they cannot be symptomatic for a longer period of time. The fourth important thing to remember is not to get into this kind of tunnel vision, I call it, with switching. So predominantly, clinicians use switching one antidepressant to another to get patients better. And STAR-D has shown us, the STAR-D study has shown us that after the second switch, switching becomes futile. So clearly you're going to start with monotherapy. Maybe you'll switch if that doesn't work, but after that, you really want to combine and augment. That's where the majority of the data is, the strength of the data, telling us what to do if antidepressants don't work alone. A final pearl that I wanted to share is to start psychotherapy as early as possible, because that is going to add resilience so that when the patient eventually reaches remission, they don't roll back into being symptomatic. A note here is that sometimes there is a too early. Sometimes patients, when they're so symptomatic, if you refer them to therapy, they're unable to engage because they're extremely symptomatic, and then they get discouraged and they don't re-engage in the process. So for the most symptomatic of patients, you want to wait a little bit before referring them to therapy. And often therapists will give you an idea. They'll say, they'll call me and say, George, this is something I can definitely help with, but see if you can remove some of the symptoms with medications first before I engage, because right now they're just going to be spinning their wheels. So that's it. That's what I wanted to share. These are the elements that I hold dear, and that I think if you can implement them, be mindful and implement them in your clinical practice, you'll be much more successful. Thank you so much for your attention.